I'm Dr. Mark Block. I'm one of the directors of Holsworth House Medical Practice. We're a high HIV caseload GP practice in inner city Sydney. Commencing treatment is a big step for a patient because it involves a lifelong commitment to be on treatment. Treatments have advanced considerably over the years. They're very safe and effective. And there are some guiding principles in terms of treatment. Because of the results of the START study that have been released very recently, this has been a large-scale global study that's looked at the benefits of starting therapy in patients with normal immunity, normal CD4 count above 500. And it was a bit unclear about whether there would be any benefit in this, but the START study has actually shown a 50% reduction in patients who actually commence therapy with CD4 above 500 in terms of risks of progressing onto AIDS or dying or developing serious non-AIDS complications. So based on this, the recommendation is now that every patient is recommended to commence antiretroviral therapy irrespective of their CD4 count to reduce the risk of progression of HIV. It's a very individual decision, and one of the key factors is that the patient really needs to be ready to commence therapy. For example, if a patient has got a fairly chaotic lifestyle, there might be some factors that actually have to be addressed before they can commence therapy. They might have to have drug and alcohol issues or unstable housing resolved before they can feel comfortable about commencing therapy. All HIV treatments involve a combination of therapies, and it's usually 3 drugs are used in combination. Sometimes they're co-formulated within a single pill, sometimes they're separate. It depends on the particular needs of that patient. The cost of therapy is subsidised by the federal government. So in terms of what to start a patient on therapy, firstly, before a patient starts therapy, it's routine to do a resistance test to determine whether there are some drugs that the virus is not sensitive to, and that can determine what options there are in terms of treatment. The Australian guidance of the DHHS guidelines makes some recommendations in terms of what are the recommended treatment regimens to start a patient on. There's certainly been a shift towards starting patients on integrase inhibitor therapy together with 2 nucleoside analogues. That would be the standard treatment for initiating a patient on therapy. Given the results of the START study, the recommendation is that all patients with HIV, whatever their CD4 count, are recommended to commence antiretroviral therapy to prevent the progression of their HIV infection and the risk of complications. A discussion needs to be had between the doctor and the patient to assess the patient's readiness to commence therapy, to discuss the issues around commencing therapy, because treatment needs to be lifelong, and also to discuss the particular patient considerations, what their other conditions are, and their general health needs.